What's the biggest barrier that you ran into when you were starting and getting comfortable with the patients?
I think as you grow as a surgeon, the way you coach your patient changes. Now I just tell them, like, you're gonna do great. Like, for my first patient, I was kind of like feeling it out, is he gonna be okay with it? And you can tell right away when you meet a patient, you talk to them, how they are and their family situation, and you know that they're gonna be a great candidate. So I think as you get more comfortable as a surgeon, then it becomes easier.
If you're nervous at all, it will show,
Yeah.
and the patients will know it. In my opinion, patients actually get better care the first 24 hours in the surgery center because we have so many anesthesiologists. We have a lot more, one-to-one, and anesthesiologists are available, so they really are safer in the first 23 hours that they're there. And a lot of them are now actually going home the same day. So I think that expectation is really the big key.
Does the same nurse do the post-op planning to follow it all the way through?
Yeah, that's part of the education package that the patients get in advance. She's really focused on having that coach at home, making sure the patient's motivated, know what to expect. She spends a lot of time with the patients. So that's definitely that extra concierge treatment that patients are getting. But as you expand the program, I think you're gonna have to start thinking about ways to optimize her role.
Are you making efforts to try to get patients to go home the same day? Because that's a direction to go as far as saving money in the flow of the facility.
Yeah, I think we touched on that a little bit.
The majority of our joints are
Mm-hmm.
outpatient, home same day.
They're going same
Yeah,
day.
yeah, 70% recently is the data.
I mean, it's not uncommon in our facility to see a patient get a total hip and 3 hours later have physical therapy, walking around, ready to go home. I mean, that's how fast things are happening. Especially the hips, they're doing really well post-op.
That's great. How about physical therapy?
Yeah, they do. We have dedicated therapists, that the usual crew of therapists that are
come
familiar
in.
with the outpatient settings. And the nurses are trained as well, so going to the bathroom, and so it's multiple times. They got multiple times before they are discharged.
We also established each surgeon has a physical therapist sort of designated to them, that these patients get contacted by the therapist ahead of time.
They guide them then to go to our outpatient physical therapy post-op, which is all set up ahead of time, and so that also decreases home health, utilization, so benefits the entire bundle.
Add to that, that your nursing staff in the recovery room, they have to be comfortable with, you're not going to just keep giving narcotic. You get on the protocol, get patients their tablets, get them something to eat and drink, get them up and out. That's all part of what the learning process is, and got us where we are today.
And so if you prep them right, and if you do the proper procedure, and you do the multimodal program, you can do opiate-free surgery.
So let's talk about the patient experience relative to the surgery center and the total joints in the surgery center, and how that differs from the hospital.
It's safer in some ways at the surgery center, but it's not for everybody, and it's not for every surgeon, and it's not for every patient.
What's key is the patient gets that key contact person through our nurse coordinator, who basically takes them through the process. Everything just runs smoother at the surgery center. They don't have to show up 3 hours ahead of time. They can show up, at a more predictable time.
Patient satisfaction, patient experience is something that hospitals measure themselves against, and something that we all benchmark. And overall, surgery centers do fairly well, I think, with patient satisfaction, usually upward 90 percentile. Our Net Promoter Score, where our patients would likely recommend a friend or a family member to our facility, is at or around 95% and sustains itself continually. But what we recently did as a part of our committee is we sort of carved out our total joint patients just to really truly see how we could measure their experience, and sent them a separate satisfaction survey, and we're getting 100% likely to recommend the facility, and fairly good response rate, about 70%.
I've converted a lot of patients that had surgery at this hospital to the surgery center. I've yet to find one that went the other way yet.